Hey, it's Dr. S, your student nurse success coach. Hope you're having a great weekend. I know of a group of students right now that are getting ready for a big respiratory exam in the morning. I am confident that you have put in the time and that you're going to do well, so get a good night's sleep, okay? Tonight, I'm going to talk a little bit about communication, and that may not sound like a very interesting topic, but I want you to hear it from the perspective of a nursing instructor and a veteran nurse. We're going to talk about communication in the form of report, okay, to start with. Nurse to nurse report, that is vital. You have to be able to collect your thoughts and the events from your shift and put it in a concise manner where when the oncoming shift nurse is there, let's say you work day shift, you've got a tired night shift nurse coming in, he or she does not want to sit there and listen to you jabber about things that aren't going to make a difference in what they have to do. That is why you need to learn your S-bar while you're in nursing school. That may sound like a very silly practice that instructors have you do, but when you get used to giving a report, a brief background, and the relevant information, you get used to hearing other students give their report, you get used to hearing other nurses give report, it'll start clicking and you'll start realizing kind of the scenario that you need to use, the steps that you need to go through. Don't give an oncoming nurse a report where everything is normal, okay? They don't want to know what's normal. They just want to know what's abnormal. They want to know what is so pertinent that they've got to make sure and write it down on their report sheet, okay? Do not give a lot of details about dramatic things that happen throughout the day, okay? Give them facts and let them do with it what they will. Make sure that you have kept up with what you're supposed to do throughout the day on your blank piece of paper or your nice little printed out template that you may have. Some facilities have like a report sheet that everyone uses, and I think that's a great idea because it keeps everyone on the same page. But learning how to listen and how to speak back and how to give correct information is an art, okay? And that's something that you'll have to develop over time. But make notes to yourself throughout the shift. Keep up with the things that you've done, what the results were, any kind of changes, any kind of new orders, anything that's pertinent that the other departments are working on to help get this patient discharged, okay? All those things the oncoming shift needs to know. If you need to call a physician or a nurse practitioner, please make sure you have all your ducks in a row before you get them on the phone. You may have pulled them out of a room with a patient, or you may be calling them as soon as they wake up in the morning. I don't know. When I first started nursing, I worked night shift, and that we had to call the physician directly on their phone, okay? And at that time, it was a landline, believe it or not. So you knew you were waking that person up and probably their spouse as well. So you better have your act together. Make sure you've got the MAR pulled up. Make sure you have their vital signs. Make sure you know what recent labs that they've had done. And thankfully you have a computer now where you can have all those tabs and it's just a click away. If you feel like it's going to be too cumbersome in the beginning for you looking for those things, write it down on a piece of paper. But when you have to interrupt them, and yes, that is their job for you to call them, but they're putting what they're doing on pause to give you their attention, and you need to be able to give it in a clear, concise way. Back in the early days of my nursing career, doctors would hang up on you if you were taking too much time, and you would have to turn around and call them back. And when you called them back, you better talk even faster because they weren't going to sit there and let you, hee-haw around about it. Like, they needed to know, what is it that you called me for? Okay? Most of the time you knew what orders you needed, but that's okay. You still had to call them and let them know. So make sure that communicating, knowing that the facts that you have are readily available and that you are ready to spout it off to them. They can give you back what they need, and that's when you have to listen. That is just as big a component to communication as speaking is. You have to be able to listen and to retain it and to do with it what they've said to do. Most of the time it's going to mean putting an order in. You got to get that straight, okay? So my practice has always been write it down on a piece of paper. Do not let them off the phone until you have repeated it back. So these skills of listening and speaking clearly and concisely need to be just matured. Okay, you've got to work on that. Now, I try every 2 or 3 clinical days to, if we have time, to have students know ahead of time that we're going to give report at the end of the shift. And when I have a student that just gets it and it's a really good flow, man, I get all excited. In fact, I had a student recently that she did so well, I told her, I could go take care of that patient now because you have given me a really good picture, but you didn't give me more information than what I needed. Now that's going to be something that's going to take a while for you to develop, but just know that how important it is, okay? So the next great form of communication is responding back, all right? We are in an age where we don't really talk to people. We text or we, message. Even in the hospitals, we have a Volt system at work where you're texting to people, which is great because, that way you don't have to, call or wait on them to call back. But you have to get in the habit of responding and giving good information, giving good details, but not too much, if that makes sense. So you're not going to answer and reply back to a physician that you're texting like you would your best friend. Okay, you need to spell words out. You need to be clear and concise. You need to let them know who you are and where you're calling from and which patient it is. And don't get in such a hurry that you just assume they know what you're talking about. When they respond back, make sure you understand what it is that they've told you, okay? This is all going to develop over time, but if you as a person aren't a good communicator or a good listener, then you need to recognize that now and start working on it, okay? When your family or your friends text you, make a habit of responding right away. Now, not if you're driving your car or not if you're in the middle of a shower or something, but as soon as you see that, or make a point every morning to look at your messages and see someone has sent me this message, they've asked a question, they're waiting on a response. Not responding is not mature, okay? That's like ignoring someone. And I have a app on my phone that's from work. So as soon as I get up in the morning, I look at that and see if there's something urgent I need to respond to. I look at my personal text messages and make sure, my kids didn't need anything. And I look at emails real quick. Now, I don't go through a dozen emails, but I look just to see if anything came through immediately that I need to check on. I do that as soon as I get up. Just takes a few minutes, and then I'm ahead of the day. If you don't do that now, I'm going to recommend you start that practice, because not responding to an email or a text is never going to be an excuse for something going wrong in clinical or in your nursing practice. Okay? You have to ingrain that in your everyday life. All right? You have to be communicating. You have to be responding back in a timely manner, especially if it goes to court. Okay? Now, I don't ever like to teach students, you do this, don't do this, because if you ever had to go to court, but that is a real life thing, okay? And if it does ever go to court, there are records that show someone sent you this request, or you messaged that the doctor at a certain time. It took X amount of minutes or hours or whatever to get a result. So I don't want to put fear in you about that, but I also want to be real with you that it could be a sign of negligence, okay? So just be mindful of that, respond back like you should, and start making a practice of listening as well as speaking. And also another thing is, when you are responding to instructions, and we're talking about in the clinical area, okay? If there's an area that you're weak in, let's say reading all of the details, reading all of the instructions, that's kind of like a red flag to the instructor that you struggle in that area. So the instructor's not looking at you like, oh, they didn't read all my instructions. They're thinking, can they cut it as a nurse? Are they going to be able to be responsible and mature and look at all of the details? Because it could be one detail that you leave out that could be detrimental. And I'm not being dramatic here, I'm just being real with you, okay? It only takes one piece of information to be missing to mess up the whole process or to delay care. Okay, so when you are asked to reply to an email or to be at a certain place at a certain time, wearing a certain kind of scrubs or whatever, and you don't see it or you don't respond or you don't, take it seriously or whatever, and you may think, really, someone would do that? You would be surprised. You would be surprised. So just kind of make that part of your professional maturity, your responsibility, the things that you're learning how to do in nursing school. Kind of self-evaluate and say, am I a good listener? Am I paying close attention to details? Am I communicating effectively? If that's something that I find myself in a conundrum about because I didn't, then I need to make a note of that. I need to work on that. So I'm going to end this with a little story here, okay? Story time's always the best time, but and this refers to communication. So I had a student, and this has been many, many, many years ago, and she is always okay with me sharing the story because it's going to save someone's life probably. Thankfully, it had a good ending, but she did not follow instructions and do as she was instructed to do, and as a result, she gave medicines to the wrong patient. Now, typically, she would have probably been expelled from the program, but there was a piece of the initial clinical paperwork and information that I did not instruct the way that I should have, okay? I think I just held it up and said, do y'all know these are the medicines that you can't give without an instructor? And because everyone, that's my dog scratching the bed. And because I assumed that everyone was good with it and understood it because no one said anything, I kept going, and I was not thorough enough with it. Now, because of this thing that I did wrong, it kept her from being removed from the program. Because one of the medications that she did give to the wrong patient were one of the medicines on that list that she wasn't supposed to give without an instructor. So there were a lot of details. She was supposed to be with another nurse. The nurse didn't go with her. And yes, that was the nurse's fault. But she could have said, wait a minute, you're supposed to go with me. The biggest thing was she didn't look at the armband. She didn't ask the patient their name. That right there could have stopped the whole problem. But she was so keyed in on, I know these medicines. I know that they're all the right doses. I know they match the MAR. She forgot that one little piece of information that meant the biggest difference. And that was she's supposed to look at the armband. She's supposed to compare it to the MAR. She's supposed to ask the patient their name. Now, thankfully, the patient was okay. They survived. But the bad part was he had already had his morning meds by his other student. She just went in the wrong room. And it was all paper. Nothing was electronic. There was another loophole. And I know we all want to say, well, none of that was her fault. Well, it really was her fault. But she told me later, and probably like maybe 6-8 months later, she brought lunch to me at work. And when I was working at the hospital, and we sat down and had lunch together. And she told me, she said, that right there turned everything around for me. I did not like that feeling of knowing I had made that horrible error and the thought that that man could have died because of what I didn't do correctly. I didn't listen to your instructions. I did not go through all the steps. I wasn't really even taking it seriously. Clinical was just something I had to check off and get done to finish nursing school. My plans were to finish nursing school and pass NCLEX and go work at this, great dermatology clinic in California and all these great plans that she had. She said, I wasn't taking it seriously. I wasn't really listening like I should have been. And she said that moment that I realized what I had done, she said, to say I was sick puts it lightly. She looked sick when I saw her, when she was coming to tell me what had happened. And she said, I don't ever want to feel that way again. And I don't ever want to go to bed knowing that I did something to harm someone and could potentially have killed them. That's a big deal. That's somebody's dad. That's somebody's husband. That's a human being. And nursing instructors can preach all day long telling students this is why you have to take it seriously. This is why you have to follow the guidelines. and you hear it and you hear it. And I think sometimes we become a little numb to it, but she will take that to her grave. And I know that. And she was young, you know, she was just an innocent little 21-year-old girl that was there looking cute in her scrubs, you know, but she did not intend to harm anybody. She did not intend on almost getting expelled from the program. She just thought that, you know, she was going to go in there and give the medicines and it was no big deal. But now she is a nurse. She passed her NCLEX. I don't think she's doing what she originally planned. And I follow her on social media and keep up with her. And she will always be special to me because I saw how scared she was. And I'm going to be honest with you, I was really scared too. And I could not tell her everything's going to be okay because I didn't know that it was going to be okay. I did tell her, I'm going to be here with you and we're going to make it. We're going to make it through this. But we got to do the first things first, and that is we got to take care of the patient. I got to call the dean. I got to call all the people in my upward chain of command, and we've got to follow policy on this. And go to the room, cry, get a drink of water. I'll be in there as soon as I can. Thankfully, he did all right. He was a big, tough man and didn't have any side effects, any problems. And, you know, I believe that was the good Lord watching over us and taking care of us. And I do pray every day before I go to work, especially when I was a bedside nurse or ICU nurse, and decisions wrote on what patient outcomes wrote on the decisions I made. And I used to pray, God, give me eyes to see anything that's going wrong and wisdom to know what to do about it, because it is that serious. And the communication factor of it, I communicated to her that she could give that patient those meds if the nurse was with her, because I was tied up with another patient, another student. She didn't listen to that. The other nurse didn't really communicate well with me either. She didn't ask me, do I let her go by herself or do I have to go? I had taught her. They all knew the process of checking that armband, asking the patient their name, comparing it to the MAR. I don't think she deliberately, in fact, I know she did not deliberately go in there and just not check the armband, but she didn't listen and she didn't follow instructions, which is all a vital part of communication. So, very sad story, very scary story, had a great ending. It turned her perception of all this around, and it was like the scales were removed from her eyes and she could see the big picture, and it changed her forever. And so I just have seen the worst scenarios of what happened if students don't take this seriously and they don't listen to detail, follow instructions, be on their, like when I say be on your toes, I mean be on your tippy toes, crossing every T, dotting every I, knowing that everything is important. And just because you may not be in the emergency room doing chest compressions and starting IVs and, you know, saving lives or something, doesn't mean that it's not pertinent, doesn't mean that it's not relevant, okay? Everything matters. And if you can learn the basics, the foundations, and then each semester build with your skills and your knowledge and your communication and all the things that you're going to be expected to do as a nurse, that's great. But don't take one piece of it lightly. Please know that there is a reason why it is part of your clinical experience, why it's part of your curriculum. And the biggest goal is to make sure patients are taken care of and that they're safe and that you are equipped to go out and be that good nurse. So the communication part, it'll come, but self-evaluate. Is that something you do well? Is that something that you are practicing now? I would highly suggest start first thing in the morning, making a point to listen extra carefully, to repeat back, make sure that you heard what you think you heard, make sure that you're following instructions down to the T, and always do the right thing, even when no one's looking. I have said that so many times. My students from 2017, they've heard me say that. Always do the right thing, even when no one's looking. Follow those steps, okay? Now, I can give you a million scenarios where a corner may have to be cut because something drastic is happening. I'm not going to get into all that because that's a great area that you'll learn as a nurse. You know, if someone's bleeding out, you're not going to worry about scrubbing that hup. I'm just talking about, for instance, okay? But always, always have those ears open to listen, and always um, be aware of the instructions that are put in front of you. Be aware of how you're speaking back to someone. Are you covering all your bases? Go back over your list of things that you did through the day. Just be self-aware that someone's life is depending on what you are relaying on to the next person. Okay? I hope I haven't repeated myself over so much that I've lost you, but I cannot emphasize enough the importance of listening and responding well, responding in a timely manner, learning how to organize your thoughts and the events of your shift, and being able to pass those things on to the next nurse. Be the kind of nurse that you want to follow, okay? And remember this, you study not just to pass the test, but you study as if someone's life depends on it, because it does, okay? That's a lot of pressure. It's a lot of do's and a lot of don'ts, but that's what makes nursing so great, is that you can do that. All right, you have the ability to get those things done. Don't expect to be perfect, just expect to be your best, okay? So have a great Sunday night and start that Monday strong and just going after life with both hands and trying to make the very best of your school and if you're a new grad, just get in there, work hard, learn all the things, and just keep knowing that I am here for you and I want to encourage and help you. So have a great evening, and until next Sunday, bye.